Good evening, everyone. This study is called Linking Individualized Education Programs of Preschool Children with ASD with the ICF, the International Classification of Functionality, Disability and Health for Children and Youth. Now, okay. How does this go on? Oh, okay. Now, for those who don't know the ICF, it is a classification system. There's a version for adults published in 2001 and a version for children and youth published in 2007. And it's a new system of classification of functionality based on the biopsychosocial model of functioning, which means that within the same health condition, which can be classified by the ICD-10 or the DSM-4, children might have different body functions and structures, different activities and participation, as well as different environmental factors influencing their functionality. And what the ICF does is classifying all these functionality dimensions because in this biopsychosocial perspective of functioning, we believe that this is what really matters for intervention. Of course, it complements the diagnosis and the diagnosis will remain. Recently in Portugal, the ICF-CY was implemented by law in the special education services. So, the main aims of the ICF-CY are to build a common language between disciplines and contexts, focused on general individualized functioning, completing the diagnosis of health conditions, as I said. There's a specific version for children and youth, and it can be applicable to research and practice as well in educational and in health settings. Okay. Now, why to use the ICF-CY model to describe functioning in children with ASD? There is evidence of the uniqueness of this population. A well-defined diagnostic category might have wide disparities among the functional characteristics of children within the same diagnosis. There is little research previously conducted on the use of the ICF-CY, though there is many studies on the use of the ICF in classifying functionality in other health conditions. And there might be requirements of specific intervention programs for ASD that may restrict the individualized nature of the assessment intervention processes, and this the ICF can overcome by describing specific functionality domains. Okay. Oh, sorry. So our focus of analysis was on the ICF-CY functionality dimensions that can be found in the IEPs of preschool children with ASD. We wanted to know what are those functionality domains and if they are included both in assessment and intervention, if there is a coherence between assessment and intervention. We had a sample of 33 IEPs of preschoolers with ASD from birth to 6 years of age, receiving special education or early childhood intervention services in the district of Porto, Portugal. We used a mixed methods approach, a sequential exploratory design, because it was a qualitative study of content analysis, and then we quantified it using descriptive statistics. Besides the deductive content analysis, we used the linking rules that were published in 2005, and the linking rules establish the criteria to match content with the ICF-CY domains. We also used inter-rater agreement. And the results show that only 23% of the functionality domains of the IEPs were included both in the assessment and the intervention. And another issue that is important is that most of the environmental factors were not included in the intervention. So the IEPs didn't mention environmental factors in the intervention. This means that despite the ICF-CY is an important tool to describe functionality in children with ASD and in other health conditions as well, there is the necessity of training and resources to make this actually work, which unfortunately didn't happen in Portugal. Okay, so we can also see that there is little consistency between assessment and intervention, but we can see the ICF is an important tool to analyze the interventions and to make suggestions for improvement. Thank you.